Welcome back, COIQ listeners. On today's show, I have Lucia Savage with us. She's the Chief Privacy and Security Officer at Omada Health. Welcome to the show.
Thank you.
I'm so glad to have you here. This is a subject that I don't get a chance to talk about very often, but I think it is something that is so relevant and meaningful for the health innovators who are listening to the show. So thank you for being here. So the first question, I think just to kind of, or not really a question, just to kick things off is just maybe start off by sharing a little bit about your background and what you do for those that are listening and don't know who you are.
Sure. I've been practicing law a long time, and when I first started practicing law, Al Gore had not yet invented the internet. And so I've grown up in my practice, as has the internet, and I became interested in doing all healthcare all the time in the late 1990s as HIPAA really was enacted, and have sort of steered my practice deeper and deeper into healthcare, and really became enamored of the possibilities of health IT as we started doing early days of measurement before the Office of the National Coordinator was even a thing. And then I got the privilege of serving the Office of the National Coordinator for Health IT as Chief Privacy Officer from 2014 to 2017, and fell in love with health IT even more and came to Omada in early 2017.
Awesome.
So at Omada, I have a portfolio of sort of all of our privacy strategy, obviously overseeing our compliance function. And just to make a brief correction, I am not in charge of security. I am in charge of the theory and law of security, but we actually have an InfoSec guy who's awesome, who does security, Bill Doherty.
Okay.
And then I'm in charge of regulatory, which is a whole new world for the IT innovation space. You know, who has to be licensed? What are the state laws that apply? How do you contract with a health insurance company? What impacts that health insurance company in your contracting process as you build out your business model, et cetera?
So, in this world where we are digitizing healthcare, and, things are changing, and you're, completely dedicated to this industry of healthcare where we have the highest standards, it sounds like it would be a really exciting time to be in your role.
I woke up this morning and I opened my phone with my cup of coffee. And of course, by that time, it was about 9:20 Eastern, and my inbox was already flooded with what was happening in DC today. So that was a little early for me at 6:20 in the morning, but it definitely woke me up. And yes, and I've recruited people saying, if you come work for me, you will read about your job every day in the newspaper.
Yes, that's exciting. That's really exciting. So, you let me know before we started here today that HHS announced a few new items just this morning. So it's kind of hot off the press. So maybe just kind of talk about those a little bit. What are they, and how do you think they affect the health innovators who are listening today?
Sure. So number one is that HHS announced a longer period for people to file comments on these two really important proposed rules. One is a rule from the Office of the National Coordinator, which defines what is considered information blocking and what is not considered information blocking in an ecosystem where apps are making data calls on the holders of protected health information. So we've been trying really hard for about 6 years to bring APIs to healthcare instead of faxes or direct connections for exchange. And this is a pretty big and important proposed rule that they put on the street. And they extended the comment period from May 3rd to June 3rd. So I would urge innovators who are building apps that might be making these data calls to really dig in on that. There's some great educational material that's digestible on ONC's website. I've blogged about it. Other people have written about it. But an extra 30 days is nice for everybody. And then CMS has a corollary rule, which is trying to bring those APIs to healthcare so that developers can build tools where consumers can get their own information out of their health plans via an API. So that can be a really important source, both for consumers being able to tell if their care has been paid for correctly, but also to collect their own health information and build a longitudinal record. And that period of time was extended as well by the same 30 days. I think one of the reasons for the extension is the second thing they released today. So Congress is always asking agencies to do things. And aside from defining information blocking, Congress asked ONC to develop a sort of a model set of contracting documents. ONC calls it the Trusted Exchange Framework and Common Agreement, or TEFCA. Mm-hmm. And one of the problems with the original date on the proposed rule was it asks a lot of questions about TEFCA, but nobody knew what the new version of TEFCA was. And so today they released their second iteration on TEFCA for comment, but this enables people to look at item 2, TEFCA, and the proposed rule together as a whole. Mm-hmm. And then the third item they released was Office of Civil Rights, which is the HIPAA regulator, released 5 frequently asked questions about, essentially in the zone of, if you are a health system, for example, and a patient presents their own app to collect their own health information from you, and you release that information to them as you're supposed to, how much responsibility do you have for security things that happen in the patient's custody? This is an important question for the doctors, and there's some really great FAQs about that try to clarify, how little responsibility a physician has for actions an individual takes with their health information, not using tools that the doctor's office didn't sponsor.
So. Right. Exactly. So, how do you think health innovators uphold their responsibility in following these laws and regulations and kind of maintaining, trust when it comes to privacy?
So it's really important to understand there's sort of 2 classes of digital health innovation that are kind of running parallel in American society. One would be the class in which Omada squarely fits, which is we use an app to deliver a healthcare service, but our entire business model falls inside traditional regulations of healthcare privacy under HIPAA. Mm-hmm. And then the second category would be, an app you might purchase for yourself and for your own health engagement purposes, but you just buy it on the App Store. There's no healthcare providing and billing going on, and that app is literally just regulated by the Federal Trade Commission, whose rules are not specific to health itself. So huge, giant, important political debate going on about that right now, related to Facebook, Cambridge Analytica, et cetera, et cetera, et cetera. But there really are 2 domains. So I'm going to talk first about the domain in which Omada falls. So legally, a company that chooses HIPAA like we did, built our business model around it, we're legally have the exact same rules as a doctor's office or a hospital. We can't mess it up, and we don't. Mm-hmm. We can't monetize the data. We can't advertise to you with other people's ads about the data. We can't give it to people except for our healthcare operations. There's like a host of rules that we have to comport with. We have to meet minimum security standards, et cetera. And that's been really fundamental to our business model because it gives our customers and our participants a lot of trust in what we do.
Sure.
I think because the rules are different outside of HIPAA, I can't really speak to those businesses because I'm not running one of them or advising one of them. But I think, that's this political debate is, what does all that mean? I think there's a lot of, journalism about that. People can look it up. And I think people rightfully should be very thoughtful about what happened, where they put their own health information, as opposed to trusting the healthcare system to have well-founded rules that have been around almost 20 years now that help us handle it an appropriate way.
Mm-hmm. Really, really great insights for our audience. So, how can health innovators uphold these regulations, especially when they have limited resources and are really focused on kind of just achieving their own business success?
Right. I think you have to really think about your business model, right? One of the things the whole Facebook story tells us is that what we privacy officers call ad tech, right, where the platform is generating advertising revenue through its data science as opposed to providing healthcare through its data science, is going to be evolving. It's going to evolve. It's going to evolve because of the California law or whatever the feds do. So an innovator needs to pay attention to what that evolution looks like if they're going to go down that path. To me, the more interesting question is, given ONC's rule, I'm circling back and you'll find
Yep.
out you can do that pretty well. What does it look like to have more apps helping people provide actual healthcare, to embrace these well-founded rules, as Omada has done, and build your model on embracing the right thing?
So give us an example.
Well, of course, there's Omada, but another example, I'll make up a few.
Okay.
So let's say that you built a connectivity system where before and after a person's ACL surgery on their brace, you had a little RFID chip that fed to an app that then went to your servers, and you did data science on that to measure the gait of the person who was going to have the surgery. And you would have a before gait and an after gait.
Mm-hmm.
And there would be this surgery intervening. So you could have a business model where you monetize that and sell the insights from that to people who want to sell sports equipment to people in rehab.
Yep.
That's outside of HIPAA. Or you could build a business model where you help provide insights to the orthopedic surgeons about which braces work better, which physical therapists are providing more effective rehab and prehab based on the gait of this individual. Or we might end up with a measure in healthcare where the orthopedist makes more money if they can prove a better outcome via that gait measure. And so those three latter examples are all straight in healthcare. If you're in one of those models, of course, you have to adhere to all the HIPAA privacy, security, and breach notification rules.
Yep.
Is that a good example for you?
Mm-hmm. Yep. It is very good. So I'm going to read here because I want to make sure I get this right. But in a recent article in TechCrunch, your CEO, Sean Duffy, said the success of digital health companies will hinge on whether patients feel comfortable sharing their most intimate data they possess, their personal health information, especially when they worry that data could impact their employment. So my question for you is, what privacy and security strategies do health innovators need to put in place?
This is a pretty complicated question, and it's probably more than we have time for today. So I'll just give you a few high-level ones.
Yes, please.
Okay. The first one I would say is that you have to really look at the kind of data you have and what its impact is for people. So, for example, we know that across the country in certain clinical categories, despite the best efforts of civil rights and equal employment laws, there is health status discrimination. HIV/AIDS is a really great example that's pretty fresh in everyone's mind.
Mm-hmm.
So think about your business model and what your data is and what the impact of people is on that data released in its raw form, and then don't do that. So figure out a way to report your value or demonstrate your value without putting information out into the universe that you know will harm people. You have to do it in a way that doesn't harm people to really get to the ethical nut of the problem.
Sure.
So that's one. Two is there are some really amazing new tools evolving for actually explaining all of this to people. Sage Bow Networks has a great open source tool that I just love. Really clear policy provisions. You can actually build in on an online interface, and I'm hoping Omada will do these things like a quiz so that people say, oh yeah, I understand what that means and I still want to do it. And then lastly, if people want their data, give it to them. If they want you to stop using it and extract themselves from the program, they should extract them. They should leave the program. Now, there are record-keeping rules, which mean you can't necessarily excise the data. That's a European concept, not an American concept. But, if people gave it to you for a purpose, use it for that purpose.
Mm-hmm. Yeah. You make it seem so black and white and cut and dry.
It's not. I know it's very complicated. I think the thing to think about is, accounting for the dignity of the individual in your business model and the reality of their life.
People before profits.
Well, we have a motto, participants first. So that is definitely one of the things we think about as we come up with our own plans.
Yep, absolutely. So, how do you think that this subject will influence the success or failure of health innovators?
I can only speak to our own experience, and we end up explaining our lives as legally equivalent to a doctor's office to almost every new customer that gets onboarded. We have a very persuasive story to tell about that, and that's what I would say is be persuasive and then stick to what you've said. So our customers have a lot of confidence in us because we have taken these obligations so seriously. We're not flippant about it. We don't, we had somebody asked me about a tech company that, asserted that it was HIPAA compliant. And I'm not talking about Amazon because I know people are interested in that. It was a different company entirely. We dug in and we put me and our CIO and a few other smart people on the phone, and it wasn't persuasive. Their story wasn't persuasive. But if you're really going to be in healthcare, you've got to master what HIPAA means and embrace it and sort of hold it up as something that is of core importance to your company.
Yeah, it sounds like you all have really leveraged this as either a competitive advantage or part of your positioning strategy, and it seems like it served you well.
I think that is true, but I will say that the genesis of our sort of fundamental reliance on HIPAA is when you are a covered entity and you collect the data, you use it to deliver your care. And so in our world, that is our data science program. And so the fact that we collect the data like a doctor's office collects data, like a hospital collects data, that is the driving force behind our data science program. And that was before my time at Omada, it was brilliant and it was intentional.
Yeah. So you mentioned HIPAA. Let's talk about that a minute. So how does HIPAA fit into this story? So many times I've seen HIPAA used in the last 5 years as an excuse to take no action or to not make any change in adopting innovation. And it seems to be driven by a lot of fear and uncertainty around privacy and security. So kind of just speak to that a little bit.
Sure. Well, you're taking me back to 2014 when I was competing for my job at ONC, and I said to Karen DeSalvo, I want to do 3 things, and one of them was I want to explain what HIPAA really says. And so we did a lot of work in that space from 2014 till when I left in 2017. Some of the guidance that OCR issued today actually comes out of work we collaborated with them on back then, and they've just kind of lifted it up and put it in a different place on their website, which is awesome.
Yep.
And so, HIPAA has some wonderfully strong limits, but it also has some really flexible and extensible features. One really important feature is the privacy and security, and the privacy rule in particular applies to, protected health information in almost any form. So it could be comma delimited file in an Excel spreadsheet. It could be in whatever database format we use here at Omada. I have no idea. I leave that to the engineering experts. It could be on paper and it could be oral. So what you and I talk about, if you're my physician, or a recording of what we talk about. And the rules are the same in all those media. And I think that that was a really prescient step that OCR took when it wrote those rules in 2000. So 20 years ago, is that don't limit it to a particular form and format, because it's whatever form and format it's in. And in that way, HIPAA has really stood the test of time. The last thing I'll say is, I would say in 2014, definitely people are like, oh, it's all HIPAA's fault. But there's been a lot of really good education. And by the way, now that people can contrast the way HIPAA actually protects information from what's happening on social media, people are really beginning to understand that there are a lot of rules that aren't HIPAA that are maybe causing confusion, maybe enhancing protection, maybe undermining protection.
So what are some of the myths around HIPAA that you could kind of just debunk a little bit for our audience?
Sure. My first one and my most favorite one, and the one that fills my Twitter feed, is that doctors can't give patients their own data. So let me break that down a little bit. So there's an old rule, it's been there since 2000, it's really old, that says patients can get their own data. And Congress is so focused on this, they've actually interpreted it for OCR twice in statute since then. And essentially, an individual can get a copy of their own data in an electronic form or format if it's available, so that can all be negotiated. No questions asked. It can't be withheld just because the doctor doesn't like where the person's going to put it. That was in this morning's FAQs, and it's in my Twitter feed at Savage. I like the first sentence. The answer is no. That's the whole sentence.
Right.
Right. You can't make an individual drive to your office just to sign an authorization. You can use e-authorizations. So there's so much gunk clogging up the works in this space that they're literally like mini industries of blogs about how terrible this situation is. And, I've written about it professionally. Harlan Krumholtz at Yale did a blind study of 37 hospitals. They published that. It's really terrible. Yeah. And when Seema Verma, who heads CMS, is talking about how she's, her husband's a doctor and they wouldn't give him his records. It's just awful. So that's my number one in my sightlines. We don't do that at Omada. We give you a lot of information right on your app, and you can show it to whoever you want.
Yep.
And so that's number one. I think number two is that, people are really afraid that if they are exchanging with another, doctor to doctor exchange, and you send the wrong Lucia Savage's records, that, it's going to be an awful catastrophe. If you actually look at the enforcement actions that OCR has brought, there's not a single one that has that fact pattern. Not one. And there's hundreds and hundreds of enforcement activities. Enforcement activities are, the fourth time around, you forgot to automatically encrypt your laptops, or, you didn't turn off former employees' accounts and they stole the data. Like, the enforcement activities are really, really terrible things.
Yeah.
Oops, it was the wrong Lucia Savage or Lisa Smith or whoever your patient is.
Right. Okay. That makes sense. Anything else, or you think that's enough?
I could go on and on and on.
Okay. I can see the passion, and I love it. And I can also, you're really passionate about all of this, but I can really sense when I'm like, oh my gosh, she's on her soapbox. I love it.
I don't want to take your time with my soapbox, but I do have an active Twitter handle, and people can certainly follow me there. And there's always not always, but there's often some kind of myth busting going on. I like to put practical, useful, and accurate information up on Twitter for people.
That's great. So I normally ask that question at the end, but go ahead and give it to him now. What's your Twitter handle?
At Savage Lucia. Pretty easy.
Awesome. So just a couple more questions for you before we wrap up. And you kind of touched on this a little bit, but I want to just make sure that it's really clear. How do health innovators stay on top of and informed about the regulatory and legislative changes that are taking place?
Well, the cheap and easy way there are two cheap and easy ways. One is to get, whatever the morning trades are that are the free version, like the free version of Morning eHealth, which is now only published 3 days a week, is usually decent. The next cheap way, like it's literally free, is subscribe to the Federal Register. So someday somebody will invite me to do a webinar on how to subscribe to the Federal Register, but I kid you not, they deliver the latest regulatory updates to your inbox every time something issues, and you just have to pick the subscription so you don't get overwhelmed with information. For example, you can subscribe just to Health and Human Services, and then it's only health agencies. That would be the FDA, ONC, CMS. And the third cheap way is follow the agencies on Twitter, because usually executives on the agencies will put out, OCR is not so good at it, but FDA is great at it. CMS is decent at it. Put out stuff you need to know on Twitter. And they all have active social media accounts. So that's all the free ways. And then I think after that, probably, look at what your product is, talk to people in your niche of healthcare, and look at how they're educating themselves on these issues that are contemporaneous and potentially important. And then lastly, commenting is so important. Almost every time I'm in DC, somebody who's a former colleague says, I want to talk more to the innovator community. Now, innovators are very shy people. They don't necessarily want to talk in public, but I will assert again, as I did in my Datapalooza blog, if we don't go to them, then they'll keep making policy that doesn't account for the needs of innovation.
Sure. Couldn't agree with you more. Absolutely. So Omada has been extremely involved in educating the industry stakeholders about the costs of not getting involved, right? Like you just depicted. So, why is it so important to you and your leadership team?
I think I'll do myself personally. I mean, I have a passion for policy and a passion for innovation, and I like to marry those two things whenever I can. So that's where my personal passion comes from. When I go out to get healthcare, I'm usually testing the system because I know how it should work, and when it doesn't work that way, it's frustrating.
Yep.
I think for Omada, we were founded in 2011, and I think that we have always kind of been on this bleeding edge, and really taking responsibility for the people looking out behind us. Now, some of those people are copycats, and obviously plagiarism is the sincerest form of flattery, so we take that, we're very flattered.
Right, you're like, yeah.
But we have some resources that a startup with 4 people or 9 people doesn't necessarily have, and so we really try to be open-minded within the domain of, we all have our own jobs to do, of really being helpful and informative.
Mm-hmm. Yeah,
I do that. Sean does that. Adrian does that. Many of our senior professionals interact with other startups, other people in the startup community on a regular basis.
Mm-hmm. Awesome. I love the work that you're doing. I think that it's really important. And one of the things that I, kind of have observed is that you're not just, as an organization, you're not just doing it for the, personal gain that Omada receives, that you're really, out there educating and informing for the betterment of the industry as a whole, which is wonderful.
That's true, but I also think that's also because it's very much in our blood that we are supplying healthcare. We have values like participants first, but we also have start with science.
Mm-hmm.
If our products are not grounded in science, then we need to rethink our products. We want to be improving the healthcare system. We started with an easy test case diabetes prevention program, and we're tackling harder, more clinically complicated use cases now that we know what we're doing. But that's the whole point, is we want to change healthcare. We don't want to break it. We want to change it.
Mm-hmm. Yep. Okay. So my last question for you is, we have, tons of health innovators in our audience today who are in the trenches. What advice do you have for them?
It's hard for me to say, because this area that the possibilities of health IT to improve healthcare are almost limitless. They're almost limited only by imagination and safety, right? We don't want to build anything that hurts people and makes healthcare worse. And since I don't know what each person's trench looks like today, it's almost impossible for me to answer.
Okay. All right. Well, I think that's fair enough. I think that some of them are, based upon my conversations with them, some of them are like really early, and they can't even imagine investing resources in this particular discipline. And then others are just really confused and really not knowing where to go and how to stay informed. And then I think the third piece that I would say is, paying for it, the financial investment that needs to be made.
Yeah, I can say a couple things. So first of all, there's actually a really great tool about what kind of thing you're building. It's on the FTC website. It's called the FTC mHealth App Developer Tool. I'll send out a Twitter link to it in a little while when I get offline with you. It was actually developed by the Federal Trade Commission, Office for Civil Rights, the FDA, and ONC, and it's kind of a nice little Q&A you can take yourself to figure out if you're building a device or a service, and what legal rules you might need to check on in HIPAA, outside of HIPAA. So that's a great tool. It's released in April of 2016, so 3 years ago now. So that's a great tool, free, paid by the American taxpayer. Underutilized, I'm sure. The second thing I would say is there are, if you're setting up a complicated data system, you need people who really understand data curation and data engineering, and people are very willing to invest in that. I think the same is true with healthcare regulation. Don't underinvest in understanding your environment. Mm-hmm. You may have to be scrappy. You may have to hustle a little bit to get that understanding, but go to people who are actually experienced in the area you want to know about.
Mm-hmm. Absolutely. Well, thank you so much for your time today and for sharing your wisdom with our audience. I know that there are going to be thousands of people that are going to find this really valuable, and they may even want to listen to it a couple of different times to really be able to grasp a hold of all of the wisdom that you shared with us today.
Well, thank you very much for having me. You asked some great questions, and I hope the information is helpful to people.
Thank you so much. Bye-bye.